we questioned that in the most recent update to the vaccine information sheet. And we basically said you may want to speak to your physician about the steroids. If you're on your way to tapering them and it's going to be a week or two before you taper them and you have the flexibility of delaying your shot until you're off steroids, you may mount a better response if you're off steroids. And so, have a discussion with your healthcare team, your physician, your nurse practitioner about whether it's worth waiting a little bit if you're on steroids.
And the only thing I would add is that if you're sick, like you're flaring, you're on a high dose prednisone and you're being treated for active inflammatory bowel disease, if the decision is to kind of wait a little bit, bring the steroids down, just the most important thing is then to just be shielded and guided. This goes back to our recommendations back for a year ago that the people who do the worst are people who are really sick with their IBD on high doses of steroids, and then they end up getting exposed to COVID at that stage. So the most important thing that time is just to protect yourself from exposures to COVID until you can kind of ride out the flare and eventually get the vaccine.